When Justin Trudeau decided that this was going to be one of the most visible, certainly, policy planks that he was going to implement in his first term in office, he turned the ball over to our first speaker to get the process of figuring out exactly how Canada was going to undertake this very complex policy task. He handed it over to Bill Blair, who is presently the Parliamentary Secretary to the Minister of Justice and Attorney General of Canada and to the Minister of Health. More relevantly, I have a whole long paragraph with Bill's biography, which he told me not to read to you, but he told me quite, I think, rightly, that the most relevant fact about him and the thing that made him a uniquely well-situated person to take on this extremely complex task is that he's been a cop, or he was a cop for 40 years in Toronto, and the chief of police in the biggest city in Canada for 10 years, something which gives him a unique perspective with which to take on this task. It's a very great honor for us to be able to kick off our conference with some remarks from Bill Blair. Mr. Blair has said that he would like to have an exchange with the audience rather than just speak to you for half an hour. He has warned me that once he starts talking about the issue, he can go on for, as he puts it, quote, days, I think was the term that was used. We won't let him do that. We agreed that he would speak for about 15 minutes, at which point I would start making various uncomfortable gestures to suggest to him that it might be time to move to questions. Unfortunately, we won't have as much time as we might have liked for everybody, certainly, to get questions in, but hopefully we will have time to get some questions in. As you're thinking about your questions, in order to get as many people in as possible, I would ask you to also think about how to express them as briefly as possible so that we can get at least a few people into the question queue. There are a few practicalities that I'll be mentioning over the course of the day. I think that since our time is limited, I'm not going to start with them now. I will stop talking and invite Bill Blair to come and give us an inaugural talk to this conference. Thank you very much for being here.
Thank you very much, Daniel, for that appropriately brief introduction, and I'm grateful for that. And I also like to express my gratitude to the McGill Institute for Health and Social Policy for hosting this and for the kind invitation today. I bring greetings on behalf of both the Minister of Justice and the Minister of Health. The Minister of Justice in particular was keenly interested and wanted to be here, but unfortunately her agenda precluded it, and so she asked if I would attend in her stead. And I'm very grateful to have the opportunity to discuss it. And quite frankly, I don't have an awful lot left to say after Daniel's excellent introduction of the topic, except I will share with you. When I was not, frankly, a politician or even involved in any way in partisan politics. In my previous life as a police officer and as a police chief, it was really important to stay, I'd like to say above the fray, but as nonpartisan as possible. But having concluded that portion of my career, I was approached by all three parties and asked if I'd be interested in standing for the federal election. One of the conversations, an important conversation for me that I had was with then Justin Trudeau, not Prime Minister, and he came to me and we talked about a lot of different policy issues, but the one that was particularly poignant between us, I think, is he asked, what do I think about the Liberal policy of legalizing cannabis? And quite frankly, what I said to him, if that's all you're going to do, you're going to make a terrible mess of this. And I said, you know, we really have to start, you begin with thinking about why are you doing this and what are the harms that you're hoping to eliminate, reduce, or mitigate? And so we talked about it. And the very first thing that he said was he was really concerned about the level of usage among young people in the country. And it is a disturbing number. There's strong evidence that Canada has the highest rates of cannabis use among its young people of any country in the world. And there are significant risk and harm issues related to that heavy use by our young people. The younger they use, the more frequently they use, and the higher potency of what they use has very significant health risks to young people in the developing adolescent brain. As Daniel mentioned, there's also the risks of young people, you know, having to deal outside of the law with the local drug trafficker, and then that has certain risks. And as I've talked to parents across the country, they were always worried about the health of their kids. They're worried about who they're hanging around with, whether they're going to finish school, and about their social relationships. And then there was a final factor that was particularly poignant to me. And an awful lot of parents said one of the things they really worried about with respect to the way in which Canada currently controlled cannabis using a criminal sanction, a criminal prohibition, is that their kid could get caught in a car late in the evening with a joint in their pocket or in the car and end up with a criminal record. And the impact of that criminal record had lifelong consequences, well beyond and out of proportion with the offense that we were trying to control. Quite frankly, in my experience as a police officer, the criminal prohibition had not achieved our public purpose aims of protecting our kids, our most vulnerable. The other thing that was a significant issue for me is that this is a multi-billion-dollar criminal enterprise. The illegal production and distribution of cannabis in this country is controlled entirely by an illegal market, criminal enterprise. We refer to it as organized crime. I'm not just talking about the mafia, outlaw motorcycle gangs, or even street gangs, but it's an organized criminal enterprise outside of the law, outside of regulation, oversight, governance, totally unaccountable, a black market, if you will, that doesn't follow any rules or pay any taxes. And so that was a significant issue for us as well, the enormous profits going into organized crime, and as a result of this unregulated market. There's also a very legitimate concern that with the high rates of cannabis use in this country, the cannabis that even our adults were using is untested, unregulated, and unsafe. We don't know its potency, and that can have significant impacts on how it affects people and their ability to operate motor vehicles and other things. We don't know its purity, and we found often with the drugs that we were testing, that we were seizing from this illicit market, that they were adulterated with chemicals unfit for human consumption, sometimes with other dangerous drugs, sometimes containing molds and other contaminants, which were a significant health risk to consumers. And as I've said, we had created a situation through this criminal prohibition for over a century in this country where the impact of that criminal prohibition enforcement was disproportionately impacting certain communities. And that is also, I think, a very important consideration in our policy change to lift the criminal prohibition and to regulate this substance. And one of the things we found very early is that it isn't simply a matter of lifting the prohibition. And as Daniel said, many people thought this is a pretty easy thing, they just legalize it. But quite frankly, the problem with that is you then have a completely unregulated supply, an unregulated distribution system. You cannot protect the health of your kids or the health of your citizens. The money still flows to organized crime. And so what it required was a very comprehensive system of regulation. So repealing the prohibition, which is legalization, and then strictly regulating its production, first of all. Now, we're very fortunate in this country, and for a number of years we've had a rather robust, frankly a fairly effective, system of regulatory oversight and control of licensed production of cannabis for medical purposes. We applied the lessons of that. We also recognized that there was really an absence of data and evidence that would inform public policy. And I think public policy should be informed by the best data available, and there wasn't an awful lot of really good data available, and in the absence of that, the advice of experts. And so what we did to begin this process, when we were elected as the government, is we went out and we appointed a task force headed up by the Honourable Anne McClellan, who had previously been a Deputy Prime Minister, Minister of Justice, Minister of Health, and a Minister of Public Safety. Very experienced, capable person. But we then brought together a task force made up of people with expertise from the fields of justice, public safety, problematic substance use, and public health. And what we asked them to do was to make recommendations for the development of a regulatory framework based on a public health model. A public health model that was intended to reduce the harms, social and health, of cannabis use and how it was regulated in this country. And in order to collect that information, we had these experts on the task force, but they went across the country. We relied on the advice of experts. I noticed someone here from the Canadian Centre of Substance Abuse who compiled an outstanding report looking at the experience in Colorado and Washington, which was very informative to the work in Canada, and thank you for it. But we also then went and spoke to medical associations, the Canadian Association of Mental Health, Pediatric Society, and many, many others, hundreds of others, and asked for written submissions and advice on the best way to regulate this substance. And I believe that based on their recommendations, they made a very comprehensive set of recommendations, and the government has responded to that. And what we have brought forward is a new regulatory regime, which will give us greater certainty in the regulation and oversight of, first of all, the production of cannabis across this country. The only cannabis that will be available for legal sale will be that which has been produced under strict license and regulatory oversight. The only place, and this was a complexity Daniel mentioned, in the discussion about how it would be distributed and how we would regulate its distribution and consumption in the country, we recognize that in a cooperative confederation, this was not appropriately dealt with. The appropriate level of governance was not in federal regulation or federal law. It was, in the most appropriate way, done through the provinces and territories. And interestingly enough, an additional layer of complexity, municipal bylaw and municipal regulation also play a very, very significant role in this. And so we then began a process of engagement with the provinces and territories, and we've been meeting with them every 3 weeks for 2.5 years at the senior official level and also at the political level. And I will share with you that the political level is probably a more challenging discussion than at the senior official level. But we've been engaged with them, and each of them is bringing forward their own regulatory regime for the distribution and the consumption of cannabis. And I'll just give you what, for me, I think is probably the most important application of that appropriate division of authority. We have for many years enforced a prohibition on the possession of cannabis through a criminal sanction, and which resulted, as I've said earlier, in a criminal record. The impact, particularly on young people, is unacceptable and can be overwhelming. And so we wanted to be able to enforce an absolute prohibition on the purchase, possession, and consumption of cannabis for young people under the age of majority, as determined in whatever provincial and territorial jurisdiction they happen to be. But we wanted to be able to enforce that prohibition without resorting to the criminal law, without resorting to the criminal sanction, arrest, criminal prosecution, criminal record. We have a model that is already working very well for us in alcohol control, because alcohol right now is again prohibited for young people in every province and territory using provincial regulation. That works really well because the police can seize the drug, the police can enforce the law and uphold the law. That prohibition can be maintained, but it's a ticket, or other justice restorative measures which are available to the police in their jurisdictions, but it doesn't mean the kid gets arrested. It doesn't define them as criminal. It doesn't propel them into the criminal justice system. And I think that's a very significant application of law at the right level. And from a policy standpoint, we believe that's the right way to deal with this. And I've heard many people say, you're making it legal for kids to possess cannabis. Quite frankly, that's nonsense. We're just not making it criminal. We're making it a regulatory offense, a regulatory prohibition, and that's a more appropriate application. One of the things I have discovered, and one of the things the Prime Minister asked me to do, is to travel across the country, provinces and territories across this country. And in every place I went, I also went into the city, and I went and spoke to the mayor, the police chief, the public health official, the fire chief, and the bylaw enforcement officer. And those people are going to have significant responsibilities, and they have an important role to play. And I'll give you another sort of sense of, I think, where municipal regulations can be tremendously effective, and that's like what we have witnessed in tobacco control. For a long time, tobacco was very normalized in our society, but as a direct result of municipal interventions through their regulations, we've denormalized the use of tobacco. There was a time, not in this room, but in rooms like this, 40 years ago, a third of the people would be smoking a cigarette. It's considered socially unacceptable today. And much of that change in societal attitude came about as a result of municipal interventions, prohibiting it, first of all, in bars and restaurants, and then eventually in public spaces, and then the provinces also stepped into that regulatory space, and it has resulted in a significant reduction in tobacco use in this country, particularly among young people. I would also tell you that we recognize that you don't change behavior just by enforcement. Frankly, one of the things I learned as 4 years as a cop and 10 years as a police chief is you cannot wrest your way out of very complex social problems. And so there has to be a whole range of interventions. And we think education and information and research are really the key to achieving the public policy goals that we have set out for ourselves. An appropriate level of regulation of production, distribution, and consumption, but coupled with significant investments in public education. It is extraordinary to me, and we've canvassed this quite extensively across the country, the level of misinformation, the misconceptions about the real harms and risks of cannabis use, particularly among young people. We asked young people about their cannabis use when operating a motor vehicle. About a third of them said that they did it and it had no effect. About 20% said they thought it made them drive better. Quite frankly, that's very frightening. And so what we're doing now is we're investing significantly in giving people facts. And I have to tell you from experience, just say no in a frying pan with this is your brain on drugs is not a compelling message for young people. But if you give them factual information in a format that they feel is legitimate, either from their parents, their teachers, a health professional, or their peers, they're much more likely to make safer, healthier, more socially responsible choices. And so we are trying to regulate, as I said, its production, distribution, and consumption at an appropriate level to reduce the social and health harms related to cannabis production, distribution, and consumption, but also through public education, change consumer behavior. And for those adults who choose to use this drug, we want to make sure, first of all, they have enough information to make safer and healthier choices. And if they choose to use the drug, we want to make sure that the drug that's available to them is safer and healthier than what they can buy in a street corner or in an alleyway. And so we want to make sure that it is properly labeled and packaged so that they know its potency, its purity, and its provenance. We want to make sure that where appropriate, there are health warnings available, and so that they can make informed choices, lower risk choices. And we think that that's the responsible approach to cannabis. Daniel, I think I'll take a breath and turn it over to questions.
Thank you very much. So there are a number, before I invite people to line up for questions, there are seats for people who have entered a little late. I see a lot of empty seats, so if we could have maybe a moment for people to just shimmy in. Wouldn't want anybody to be standing. There's seats around this side as well. So we have mics on both sides of the room. I would invite people to go to the mic. And please keep your questions brief. We'll take about 15 minutes for questions, and I'll have to cut things off to move to the next panel. So if you could keep them as brief as possible. So if we could start on this mic over here.
Hi, thank you so much.
You could introduce yourself as well, that'd be great.
My name is Jennifer. I was an intern with the IHSB a couple of years ago. I want to ask you to elaborate a little more on you went on about how young people get these criminal records and how it's very, very damaging for the future. My question is very simple. What happens to the young people who have criminal records, or people who have criminal records, period, often who are disproportionately representative from disadvantaged and marginalized communities?
Yes, ma'am, and it's not a simple question because the answer is quite complex. Right now, the system of cannabis control is the criminal law, which has been in place in Canada since 1922. And there are nearly 500,000 Canadians who have a record for simple possession. For many of them, it's the only record they have. For others, they're rather intricately linked with other criminal records and charges, et cetera. But for the vast majority of them, they are simple, non-indictable records. I've been asked many times about what about those people. First of all, on a going forward basis, the risk of obtaining that criminal record, we're eliminating that risk as we go forward. But of course, the question is so often asked is, what about everybody else that's already got this? And I will tell you from experience, I know a ton of people, and I'm sure there may even be people that have this experience in this room. As a result of a youthful indiscretion or some choices they made when they were younger, they have this criminal record. They lead otherwise exemplary lives. They are fine, upstanding, honest, decent citizens, and yet that criminal record has an impact on the quality of their life and on their opportunities, and quite frankly, has an impact on the whole community because we limit that individual. And so I think it's an important discussion that we will have in the future. But in my opinion, that discussion follows the repeal of the existing system of cannabis control, its replacement with a very comprehensive system of regulation. And once that legal change has taken place, the Prime Minister has stated that he will examine that issue, and the government will address that issue. But that's the appropriate time to deal with it. You can't nullify the existing law. That's not how the legal system works. We're working very hard to repeal and replace the existing law. And once that work is done, I'm confident we will try to, in a very fair and just way, address the issue you raised.
Please, the other mic.
Good morning. My name is Pierre Colleen. I work for the Hydropothecary, a licensed producer of cannabis.
Yes, sir.
A pleasure for the chance to be here today. Very curious about what your vision of a Canada with under legal cannabis looks like. There's been a lot of talk about all the bad things that can happen, but just from the government's perspective, or even your perspective, what is the vision of a Canada under legal cannabis?
Well, there are people talking about cannabis as if it was some new substance that we were about to introduce into Canadian society. I get that all the time. Honestly, I go into towns and cities and they say, well, what are we going to do when they have all this cannabis? I said, well, you got it now. When almost a third of people between the ages of 18 and 24 report that they're using this drug, that's not a new thing. It hasn't been a new thing for a very long time. But what is new is a different set of choices. And I think more information so people can make informed decisions, and choices which are healthier, legitimate, as opposed to the current regime. And again, I'm a little cautious when I talk about the current illicit regime. It is illicit. It's all outside the law. It's all criminal. But they're not all necessarily gangsters. But it's a criminal market. I think what's going to change is when we, and by the way, you'll hear this phrase a lot from me, and you haven't heard it yet this morning. This is a process, not an event. People keep on talking about the date of implementation as if we're going to throw a switch and the world is going to change overnight. That isn't how the world changes. It's going to change incrementally. There'll be an implementation, and we'll see the retail environment will be built out. I think the licensed producer environment is still very much in transition as it's going to move from a medical market over into also supporting this recreational market. I think you'll see great evolution in the medical regime as well, because one of the things in a prohibition environment, it's difficult to do the research necessary to support that medical market. I think that'll now be possible. It opens up new opportunities. And when we have now it available for legal sale, I remember, I'll just share this example with you. When I was a young cop, in Toronto we had 17 divisions, and every division had a plainclothes unit, and one of the big jobs in every one of those plainclothes units was to go do illegal gaming houses. We had illegal gaming houses all over the place, and they were run by criminals, and we would go and knock them off. Illegal gaming houses being found in even was an offense in the criminal code, and so we did a lot of that work. We had 2 units at headquarters that did wiretaps on off-track betting and numbers rackets, and there was, extortion rackets and all sorts of things that we worked on related to the criminal control of the gaming industry. And then starting in '76 here in Montreal, they started a lottery for the Olympics. It then spread across the country where we began to regulate gambling. It then it developed into the emergence of casino. We now have a regulated gambling industry where Canadian gamblers, Canadian gambling consumers, have a legitimate place to go. And quite frankly, there's not a single police service anywhere in Canada that has a standing gambling unit anymore. It was big work for the police 40 years ago. It's not today. And another thing that I think is really, for me, striking about that, I've gone into communities across the country, and I go to addiction treatment people and talk about addictions because it's an important issue in many communities. And they say if somebody presents themselves with a gambling addiction, they go straight into treatment because it's funded by the casinos. But if they come in with a drug addiction, on average they wait 9 months for treatment. We may change that. And because the commitment we've made is that the revenue that will be generated from this, again, in following with our commitment to these public policy goals of reducing harm, that the revenue generated from this has to be invested in treatment, research, prevention, and rehabilitation. And I would differentiate that from the American experience, quite frankly, that had ballot initiatives where they said they were going to legalize it and tax it. And based on those initiatives, the focus is on revenue generation. And one of the struggles I have had, and don't get me wrong, we need a thriving business environment to support this industry. But for the government, the emphasis can't be on generating revenue. The emphasis has to be on reducing those public harms. And that's why that public health framework for the model of regulation and production, distribution, and consumption is so important. And it's one of the reasons, quite frankly, in every discussion we have about this, and in every room I walk into, we begin with those public policy goals, and we remind ourselves constantly, that's why we're doing this. And it keeps you on track, keeps you focused. And so if we keep on that track, I see a healthier, safer environment, and that's where I see the country going into. A healthier and safer place, a more responsible use among adults for cannabis, and hopefully through better public education and some of the restrictions we're putting in, facilitated by better conversations between parents, health professionals, teachers, and their kids, we could actually reduce the harm of the very high rates of usage among kids that we currently experience.
Hi, Malcolm Bird, University of Winnipeg. Thank you, Minister, for coming. I have 2 questions. One is, the federal
Maybe
government...
just ask one.
Just one?
Yeah, probably,
okay.
yeah.
I'll give you 2 answers about that.
Okay. Is the federal government going to? Okay. What if pot consumption rises? Are you guys willing to make a normative statement that consuming pot is a problem and set out to, quote, denormalize pot consumption?
I want to be really clear. It is not the government's intention to promote the use of cannabis in this country. Absolutely not. That is not one of our policy goals or our intent. As a matter of fact, we believe that through public education and for the promotion of lower risk guidelines for adults and greater restrictions for young people and education for young people, we can actually reduce the incidence of use. But I will also share with you, I've seen a lot of, like, there's statistics, that old lies, damn lies and statistics. I've heard a lot of interpretations. I've heard in Colorado, they had this massive surge. But I had a letter from the governor of Colorado, we got copied on it, but he sent it to the Attorney General of the U.S. that gave the facts of that. And that was not their experience, that there is not this huge surge in cannabis use. Those who use cannabis will now have safer, healthier choices. And I think for the overwhelming majority of people who choose not to use this drug, I will tell you, I don't use this drug. I have never used this drug. I worked undercover for a number of years. I've actually bought a ton of this stuff, but I never used it. It would have been kind of hypocritical to use it, given that I was enforcing those laws. I've never used that drug, but somebody asked me on TV a couple of months ago, they said, you know, when it's legal, are you going to use it then? I said, no, absolutely not. Frankly, I think it makes you stupid. And so it's not my intent. I try not to say that in a judgmental way, but it's not for me. And I think for the majority of Canadians, if they choose to use it, we want to make sure that they can do it in a healthier, safer way. And for those who choose not to use it, they have alternatives. We have in this country, to a large extent, normalized the use of alcohol. And alcohol is the basis for an enormous number of social and health problems in this country. It probably kills 25,000 people a year, and it's responsible for much of the violence and social dysfunction that occurs in many of our communities. And we have normalized it in our society. We have learned the lesson of that, and we're not doing that with cannabis. I think we've learned additional lessons about denormalizing a substance with tobacco and reducing its usage. And although we've still got a long way to go, we've made some real progress on that. And so those lessons are also being applied. I think one of the things that I would point to, just try to give Canadians a better sense of where we're going on this thing, the real guidance and these regulations in our government is not overseen by the Finance Department or even the Justice Department. These are health regulations. This is going to be overseen by a Cannabis Secretariat within Health Canada for its production and distribution and all the regulations with respect to marketing and promotion. All of those are being developed and promulgated through a health lens.
So I think if we go in terms of work, yeah, oh, please, yeah.
Yes, Mark Chenier. I've been involved in the cannabis hemp movement since about '94, and my question involves hemp. And are we going to see a day where you're going to allow for the legal sale of hemp in the supermarket, non-THC varieties, where we can have it next to the cabbage and the kale, where people can start eating this in a salad like it should be?
I think there's a really important conversation to be had about industrial hemp. There's currently in Canada about 100,000 acres under cultivation for industrial hemp.
I know.
We have pretty strict regulations, and it's still regulated through the Controlled Drugs and Substances Act. It is included in the regulations of the Cannabis Act. But I think there is an opportunity to have a more fulsome discussion. When you move out of a prohibited environment into a regulatory environment, then we can start making decisions about how to regulate substances that have very low risk. And certainly for low THC content hemp, we've already seen a real movement towards more development of more of those products, you know, either as to be regulated under different regulations like food and drug or even natural health products. Like there are different ways in which this can be approached. It is moving into the Cannabis Act. So in the very short term, unfortunately, the answer is no. But I think the opportunity exists for future research, future development, to inform a more reasoned.
Can I ask one more question then?
No, we have. I'm sorry, we have 4 people who are still at the mic. I'm sorry about that, and we're already behind schedule. So please.
I'll be quick. My name is Bonnie Fagenbaum. I teach the social marketing class here at Des Hotels. I have a question about the public policy. So you talk about all 3 levels of government having to work together, yet you have some municipalities adopting the NIMBY approach, not in my backyard. For example, we have a town of Hampstead who said, no smoking at all in our town. Yep. How are we going to deal with that mixed messages that are being sent? Federal government says okay, municipal says not here though.
To be really clear, at the federal law, we establish a line above which is a criminal sanction, and below which can be regulated. Frankly, we try to be very respectful in our dealings with both provinces, territories, and municipalities in their authority to bring in regulations that are appropriate for their context. You know, it's a vast country. And as I've traveled across the country, I've come to appreciate that there's a reason why the law will be nuanced and somewhat different, tailored to the experience in, say, British Columbia versus Prince Edward Island. We also recognize that different municipalities have different contexts, different abilities. You know, for example, they talk about personal cultivation, which is a really complex issue. I was in Saskatchewan, and I'm saying, you know, the municipality will have the ability to pass bylaws and enforce them with respect to permitting and where you can do this, and fencing and security and things like that. And they said to me, but we've got municipalities that don't have the wherewithal to even pass a bylaw, let alone enforce it. When you come from Toronto, maybe you didn't really appreciate that, but I've come to appreciate it. And so, you know, we're working through these things, and I'll go back to my earlier statement. This is a process, not an event. In Toronto, I've run into an interesting situation because, well, they announced the very first retail store for the Ontario model. It's going to be my riding. And people, oh my God, we're going to have a cannabis store in our riding. I'm saying, well, we've had 4 illegal dispensaries. And they said, but it's half a kilometer from the school. And I said, well, it's going to be really bad news for the 14 drug dealers who are in the neighborhood between the school and the new store. Like, and so you get a choice. Do you want this sold by a government-regulated store where the adult there is accountable for the decisions they make and who they sell it to? Do you want the product that's being sold in a plain cellophane bag, or do you want it in a properly labeled front of package? This is what's in it, this is its potency, assured purity, you know its provenance, you know exactly what it is you're consuming, and it's available at a competitive price and quality and choice. I think most consumers would rather go there than to the drug dealer in the schoolyard or in the stairwell or wherever.
We're running over time, it's very bad news for a conference when you're way over time at the first session. We'll be here till, but it's such an opportunity to have Bill Blair here that I'm going to let this go for another 7 minutes.
Daniel, I'll try to be brief.
So we might not get to everybody, but please.
I just wanted to ask, hi, I'm Jeff Callahan, postdoc fellow at the Faculty of Law. I wanted to ask whether and to what extent, if it's true, the government has engaged existing marijuana distributors and cultivators, to try to learn some of their expertise over the years that they've garnered, but also maybe to bring them into the fold to keep them from competing with the government once the regulation goes through.
No, the point you make is a very challenging one. I can tell you that there is ongoing discussions about genetic diversity in the product available, because there are literally thousands of strains in the criminal marketplace, but the number of strains available in the new regulated industry are somewhat limited, and so there has been that discussion. We've talked about the introduction, and we've just gone through a very significant regulatory discussion process. And we're bringing forward regulations that will allow for micro producers and micro processors. And what we've said is that the security requirements, we have very rigorous security background checks and security requirements for licensed producers, because we really are trying to displace the illicit market and bring forward an accountable, legitimate industry around this thing. But we've said, particularly with microprocessor licenses, for people with a nonviolent record, for simple possession, we don't think that should necessarily preclude them from participating in the market, which I think that's a very significant step forward. One of the things I will tell you we've learned a great deal from and applied our lessons is, since 2002 in this country, we've had a medical marijuana system originally under the MMAR regulations. In 2013, we introduced the marijuana for medical purposes regulations, which produced the licensed producers. And we've got a great deal of experience in regulating that activity. And quite frankly, as a cop, I've been in a ton of illegal dispensaries, or illegal grow-ops. You walk into the house and there's mold, and the house has been converted, and it's uninhabitable. And frankly, it's a mess. And then you go into a licensed producer, and I don't mean to sort of pump up the industry, but for me it was revelatory. You walk in and it's pristine. You can eat off the floor. there's no smell emanating outside. The security in the place is penitentiary-like. Like, it's really quite extraordinary. And so what I learned from that experience is that this can be done right. I've been in all sorts of places as a cop where it was being done wrong, and then I had the opportunity to go and see it being done right, and we tried to apply that. And frankly, it gives you confidence that there is a right path, and it's a regulatory path. The enforcement path, quite frankly, was failing our communities, it was failing our kids, and enriching criminals. And a regulatory path, I think, gives us an opportunity to reverse those harms and to make a safer, healthier environment for everybody.
Please.
Yes,
Good
ma'am.
morning. My name is Daphne Elisma. I'm representing patients who use cannabis for medicinal purposes. And my question for you today is on taxation. Right now in our country, we have like way above 270-something patients who uses cannabis for medicinal purposes. And right now we're being taxed. And cannabis is prescribed through a physician. It's the only prescribed drug right now that is subject to taxation. And recently, your government just also add an excise tax on medical use of cannabis. So my question for you is, when is your government will reconsider this whole taxation? Because it's representing a huge burden on us patients, because we're using cannabis out of medical necessities, and the court has been really clear on this, that the way that we're using cannabis right now, it's really for medicinal purposes. It shouldn't be taxed the way that it's taxed right now.
Let me be really clear. That is not what the courts have said, and quite frankly, I just want to correct a couple of things that you said. In the early 2000s, we had a number of court cases in which the courts found that people had a legal right to access cannabis at a competitive cost and at a competitive choice. And they created a system in law for medical authorization. It's not a prescription. Cannabis, with a few, 3 or 4 exceptions, there are cannabis preparations, not the raw product, dried and smokable, but there are certain preparations that have been qualified as prescription medicines with a drug identification number. And they, under Schedule 6 of the Excise Act, qualify for exemption. But the overwhelming majority of cannabis products being consumed today are not prescribed, they're not dispensed at a drugstore, they're authorized for use, and it's an exemption from the existing criminal prohibition. That's actually the system. And the issue of whether or not they should be exempt was litigated in a case called Hedges at the federal court level, and it did not qualify for the exemption. And so we have said, when we brought an excise tax in on the new regime for cannabis, that all cannabis, regardless of how or why it is consumed and by who, will be subject to both the excise tax, which we've set very, very low compared to other jurisdictions. The taxation regime, I was very much involved in the development of the taxation regime around cannabis, and that taxation framework establishes both the application of an excise tax, which is $1, divided 75 cents for the provinces and territories, 25 cents to municipalities. Hopefully a lot of the money going to the provinces will flow also to the municipalities to cover their costs. And it's also subject to harmonized sales tax where it exists. And so that's the taxation regime. We have also said, though, that for certain preparations, and in particular, CBD preparations, for those maybe not familiar with these cannabidiols, which is a cannabinoid, which is non-psychoactive, and for oils and preparations that have a very low THC level, below, I believe, 10 nanograms, less than 0.03%, very low THC levels, but high CBD content, which is being used and has shown certain medical efficacy for epileptic conditions, particularly among kids. Those will not be subject to the excise tax. And so that exemption's been granted, but for all of the other cannabis, which is THC, and just important for people to understand, this is not yet a prescription medicine. It does not have a drug recognition number. In Canada, there is a process, it's rather a rigorous process, by which drugs, all drugs, are qualified to be prescribed. And it's a process of clinical trials and standards that must be met. And it requires evidence. It's not a legal choice, it's a health sciences choice. And so then when they qualify it, and for any cannabis product that has gone through that process and qualifies as a prescription medicine. It also has to qualify not just for a DIN, but also to be prescribed. And there's a process that identifies and defines that. They would be exempt under this regime. But for the vast majority of cannabis consumed, even within the medical regime, is authorized by doctors, not prescribed, is not exempt.
So I'm going to ask the two last people who have come to the mic maybe to ask their questions in seriatim, and then we'll give Bill a brief moment to respond. So please.
Thank you, Bill, for the opportunity to ask the question. My name's Caitlin Hughes. I'm from the National Drug and Alcohol Research Centre in Australia. So my question is twofold. What has been the reaction of the policing institutions in Canada to the reforms? Are they supportive? Are they concerned? And secondly, what's been the response at the international level, particularly at the recent Commission on Narcotics Drugs meeting?
That's a huge question.
And we'll have time for a brief answer.
Hi, how are you? My name's Abby Roach. Without properly licensed consumption spaces, not only do we create a new class of bylaw criminals, we also lose the front line of safer consumption education. What would your recommendation be to municipalities in terms of regulating consumption lounges and properly licensed spaces?
Well, and I'll tell you,
simple questions.
That one's pretty straightforward. Each of the provinces and municipalities have the jurisdiction and authority to make that determination. The advice that we've given them is the advice echoed in our task force report, was start cautiously, carefully, strictly. One of the lessons that was learned from the Colorado and Washington experience shared with us by CCSA was that you can be very strict and ease up later as evidence and experience informs you, but it's really tough to start really loose and then tighten down later. And so we've tried to apply that lesson, and we've shared it with the provinces and territories. And with respect to the Australian experience, there's two things the cops hate: change and the way things are. And I know that because I wasn't just one of them. I kind of led a lot of them for a long period of time. We began meeting with them about 2.5 years ago. I did with Canadian Association of Chiefs of Police. I used to be their president with their National Organized Crime Committee, and I used to chair it, and started talking about a more effective way to deal with this problem. I think all of them will acknowledge, and have acknowledged to me, that the current system of criminal prohibition was not working, that they were not able to achieve their public purpose aims of keeping their communities safe, and in particular protecting their kids. And so there was an acknowledgement that this wasn't working. They had concerns, legitimate concerns about this is new, and they have to learn new law. They need training. They need access to new technologies, particularly to dealing with impaired driving. And they had some law enforcement capacity issues. And so as part of that discussion, we met with them and have addressed that. And frankly, we've made significant monies available for the training of police officers, $161 million, and to provide them with access to those technologies, and also to deal with some law enforcement capacity issues. Because the RCMP and CBSA said we don't have the resources we need to deal with organized crime involvement in this thing, and the CBSA said that they were concerned about border integrity issues. And so we put a lot of money back into that as well. But it's not just a matter of money. Law enforcement will have a significant role in this, but I think it's a mistake to place a lot of emphasis on the enforcement of regulations. I think when you give Canadian adults in particular a choice, a safer and healthier choice, a more socially responsible choice, we're not going to have to enforce this. And I'll go back to my earlier analogy with gambling. We used to have about 130 cops that worked almost full-time on gambling enforcement when I was a young cop. We don't have any anymore in Toronto. And it's because enforcement is not the way in which we change the way society managed that particular issue. It was by giving people a regulated choice, a safer and healthier choice, that they moved. And again, it's part of the process. And so there is a role for enforcement here. But I don't, frankly, we're not trying to create a situation where we're going to drag a whole bunch of people to court or even make it easier for the police, like a ticketing scheme. Quite frankly, if you want to process a kid for possession of a joint, it takes about 22 hours of work. If you want to write him a ticket for it, it takes about 18 minutes. And there is a concern that has been raised. If you make it easier for enforcement, are we going to see more enforcement? Enforcement is a tool. It's not an end in itself. What we've said is that all enforcement, particularly around kids, has to be guided under the important principles of the Youth Criminal Justice Act. The YCGA, which says the police must consider alternatives. And I will tell you from experience, if those alternatives are available to them, if you could, as opposed to just doing nothing, which hasn't been working either, if we have resources and alternatives to do a better job of getting that kid back on the right path, then that's the path that we want to take. It's not through enforcement, but enforcement is where necessary, but not necessarily enforcement. I think that would be sort of the way I would respond to that. Internationally, it's a challenge. Right up front, there are 3 international conventions that have been around since the early 60s that says everybody has to criminalize that. But quite frankly, for over a decade, or actually for the last 4 or 5 years, the United States hasn't been in full compliance with that particular convention. Many European countries are not in full compliance with that convention. I think every country has a responsibility to do everything it can to protect the health and safety of its children. I think every country has a responsibility to deal effectively with organized crime. And I believe that the regulations we brought forward in Bill C-45, supported by the regulations in the provinces and territories, will do precisely that, enable us to do that. And I would point out to those international partners, illegal production of cannabis in Canada remains a serious criminal offense. Illegal trafficking of cannabis remains a serious criminal offense. Illegal import-export will remain serious criminal offenses. So we're living up to our international obligations, but we're also living up to our obligations to our own kids and our own communities. And that's why I believe it was the right thing to do. And so, you know, it's an important discussion, but I've been having discussions with people from all over the world, including most recently with representatives of the Australian government. People are very interested in Canada's approach because our approach has not been the criminal model and it has not been the commercial model. It's a public health model. It's a public health framework focused relentlessly on reducing social and health harms. And quite frankly, I think many countries in the world find that a compelling approach, a different approach. And I believe we have an opportunity to demonstrate in a good old Canadian way, based on Canadian values, that this is the right way to manage this issue. And I think many countries in the world are watching very carefully what we do. I'm mindful of the responsibility that places upon us to get it right. And I'm cautious because I've been involved in enough social change over the course of nearly 4 decades to know that it's more of a process than an event. But we're working hard on it, and we're going to stay focused. And the last thing, and I promise you, Daniel, last thing. One of the things we commit in keeping with that process, we've done a lot of work to make sure that we begin with good baseline data. Public policy should be informed by data. And frankly, we've got an awful lot of anecdote and not an awful lot of data. So we've gone to Stats Canada, we've gone to academia, we've gone out and to a lot of different organizations and collected the best baseline data we can. And we've made a commitment to the relentless collection and continuing monitor of the situation as it evolves. And we have a commitment to adapt and respond to the evidence and our experience. And hopefully, because of that, we'll continue to work hard to get this right.
Please join me in thanking Bill Blair.